So when we're talking to families about putting their child on medication, in particular, they tend to be concerned with SSRIs because of the black box warning that's on them. And that black box warning is for anyone who's under 25 years of age for increased suicidal thinking. Now, the good news is it is a very low risk, but it is obviously higher than if you're not on the medication, which is why they put it on there. So we talk a lot about in the first 2 to 3 weeks of a child or adolescent being on the medication to make sure that we're watching this more closely. There's been a lot of study that has been done on children with OCD, not replicating that increased risk for suicidal ideation. So we don't believe that they're truly at higher risk, but we still want to be really cautious because kids with OCD who have depression, which is common to go together, we know that they can be at risk. So we definitely talk about that a lot, monitoring a child more closely when they first start that medication. I think the other thing that we particularly watch in younger kids too with the SSRIs is if they're going to do anything to their appetite. So we know it's an important growth phase for them. And so we want them to continue to grow in their normal development. So if they're not eating enough, that could affect it. Most of the SSRIs don't have a large effect on reducing appetite, but they can. So that's something that we really think is important to watch. And then sleep patterns are super important for all of us. But as you can imagine, again, with growth and all these things happening with school and everything, we want kids to sleep well. So the other thing we really watch is if they happen to affect sleep. Do they make someone tired? Do they make them more awake? And just trying to ensure that we're not affecting sleep. A lot of families are particularly worried that we're going to affect their personality or dull their personality, which should not be the goal of any of us, and I don't think is the goal of us as child psychiatrists. I always tell parents we're absolutely aligned on that goal. And so really the goal is to get their child back to the developmental stage and phase that they were in before OCD took over. So we want to help reduce their symptoms so that they're their typical selves. If there is a dulling, that is something incredibly important that we would want to discuss and to figure out so that we could, change medication because then they're not on the right one.